They would never in a million years think that they would ever do ketamine, but they're so sick and tired of being sick and tired, and they're so sick of like having their antidepressants for 30 years and it's not working, and doing a lot of hard work in talk therapy, but just being stuck, that people are like, okay, I'm willing to do this. I'm willing to try this. It's a prescription medicine. It's been proven to be safe. A lot of the outcomes are even more promising than traditional psychotropic medications and things like that. So people are willing to try, just like you're saying, people are willing to try things that will work, and so informed consent is a huge piece of that. You want to be able to educate people on the risks and benefits and alternatives, but people want to help themselves in a way that's going to be helpful and not just do the same thing over and over again and get the same result.
Hello. Welcome back to the Ketamine Connections podcast. I am your host, Anna Krishtal. I'm always happy you're here. If you're back, welcome back. If you have it in your heart to leave us a review, let's just get that out of the way right away so that we can dive into today's episode. And I gotta say, I'm always excited to talk to people on this show. I love hearing people's stories. It never gets old, whether we're talking to clients, clinicians, founders, people who are just interested in there. One of the things I want to bring on the show is for someone to come on and interview me. So if you want to be that person who comes on and asks me questions, come on down, right? Shoot me an email, hit me up in the show notes and let me know, because I would love to do that as well. So I'm always excited to share stories. We heal through stories, we learn through stories. And when I heard about Dr. Emily Bullock, I knew that she was going to have a lot of amazing stories to share, and she did not disappoint. I saw that she is into yoga, that she is into other modalities, somatic work. I saw that she is the owner and founder of 4 clinics. Like, what a powerhouse, right? Oh my gosh. And so the interview that we did today did not disappoint me in the least. She brought so much wealth of information into this conversation. She talked about, her background as an Air Force officer. We talked about her background in going from like really clinical, really like box checking type of therapy to what she offers now that is more holistic, that is more somatic. We also talked about how, hey, that's not for everyone, right? And so in her business, she has offerings for the people that want the more clinical model. And then we talked about the people that want a different, more therapeutic model, right? So people that just want the ketamine, and then people that want the ketamine-assisted psychotherapy, and the difference between the two and how that's beautiful that we have these different offerings. We talk about that so much in the show, how ketamine is not a one size fits approach and how you can make ketamine work for you. Emily was a pure joy to have on the show, and I was completely blown away by the breadth of her experience, right? From clinical to holistic, from, yoga to ketamine, from checking boxes to getting out of the box. We also riffed on some of the things that she's doing in her practice that are really prepping the subconscious mind. She has set up a practice that I really deeply admire. If you're in the Salt Lake City area, or again, I'm becoming more of an advocate for ketamine tourism. So maybe you go and you stay in Salt Lake and visit one of her clinics. And if you're considering about setting up your own ketamine-assisted psychotherapy practice, we talked about the course that she put together that is literally years of her experience, years of knowledge that she has paid for and acquired through practice, which, by the way, you cannot put a price tag on experience. We talked about the course that she offers. All of that is in the show notes. And I think that it would be a gem to learn from this woman. We had a beautiful conversation. I cannot wait for you to hear it. So let's dive into this episode today. Allow me to interrupt myself real quick with a side note that could change your whole ketamine journey. I have been getting feedback from listeners like you that the podcast is helping you feel more prepared, grounded, and confident about your ketamine journey. And if a free episode can do that, just imagine how supported you could feel with a full ketamine preparation system. Because the truth is, following a preparation protocol is the best way to feel safe in your first ketamine journey. Unfortunately, most clinics don't actually know how to set you up for a life-changing experience. And that's okay. Their job is to execute, not prepare. But after years of working one-on-one with clients, I know you deserve better. That's why I created the ketamine preparation protocol, a proven system built from everything I've learned to help people feel confident, calm, and clear heading into your sessions. After completing the beta round, one client told me, "This got me thinking about my journey in a whole new way, and even asking the clinic better questions." Whether you're getting ready for your first journey or realizing now that you want to approach your next one differently, the system was made for you. It can support you before, during, and even retroactively after your sessions to help create real change. Head to the link in the show notes to learn more and to join KPP today. All right, let's get back into the episode. Hi, I'm live here with Dr. Emily Bullock. Thank you so much for being here, live from the state of Utah, Salt Lake City. And tell us, if you can go back and tell the you before you started all this anything, what would you tell them?
Yeah, this was a good question and really got me thinking not only about kind of before I started the psychedelic medicine journey, I guess, providing services and also kind of experiencing medicine myself, but also just in general on my mental health journey. I think what I really would have wanted to know at that point is that the healing is already within us. We just have to uncover all the mess and the dirt and the layers of the onion and unpeel all the layers, move all of our resistant parts and the trauma and everything like that to come and find ourselves again, because that's where the healing is. And so it's always within us, but sometimes we need a little bit of help. Sometimes a tool like ketamine is a tool. Sometimes meditation, yoga, talk therapy, these are all tools that can help us peel away those layers to find ourselves and find our healing. Because one thing, looking back on, my 20 years of my mental health journey and also my journey as a clinical psychologist, I would hear about a certain type of treatment and think, oh my gosh, that's like the magic bullet. That's what's going to do it. Or for me, when I first learned about ketamine and went on my ketamine journey or researching about psychedelics, ayahuasca, there's a lot of documentaries or YouTube videos where someone does a medicine one time and they're like miraculously healed. And so I think there's some misinformation out there, like that's not common. And you can't really look outside of yourself for healing, but you can look outside of yourself for tools or helpers to help you unpeel all the layers to be able to reconnect with yourself. And that's where the healing is. So I wish that I would have known that, because I had some expectation management issues myself on my own healing journey when I would do a treatment or a medicine and it wasn't a magic bullet. Then it's like I was thinking, oh my gosh, there's something wrong with me, when really these are all just tools that we can use that can help us uncover and unpeel away all those layers. So
Yeah. What a powerful message, right? I really resonate with so many elements of that. And I just want to kind of, let the audience know, because they're not reading the same bio I am, that you have a military background, right? And so I'm curious, when you're talking about going back and talking to your previous self, like where in the journey were you in that? Because I've talked to a lot of military vets who are on a lot of healing journeys. And so just coming to that realization for themselves. And I'm curious, like, how would you have received that? The you that you're talking to, right? Like, how would she have received that, of just like, there's no magic bullet, and she's like on this hunt for a magic
yeah.
bullet.
Well, and I think it's also hard when you're coming from a medical type training. I went to my doctoral program was an APA accredited graduate program where we had rigorous, education and training that we had. And so we were always having to read the research and we had to learn all these evidence-based treatments. So in the research, the whole point of doing research on these different treatment protocols is to see what's going to be more effective. So in my brain, I don't know that professors were really teaching us this, or if this is just what I was perceiving.
Mm-hmm.
But in my mind, as like in my 20s going through grad school, thinking, oh, people with depression, people with anxiety, people with PTSD, they do this treatment and then their symptoms go down, they reduce by 80% or whatever, and then they're better.
Mm-hmm.
So I think coming from the medical model, you think about there's like a symptom or an illness or a disease, and then there's a treatment that like fixes it almost.
Right.
And then these randomized controlled clinical trials or these evidence-based, protocols are being used to then reduce the symptoms down so people don't meet criteria for that diagnosis anymore. So you would just begin to think, oh, well, if there's a problem, then you need something to fix you. But really that is not true. Like all the evidence-based treatments, all the psychedelic medicines, all the meditation and, getting on your mat every day with yoga or whatever you're doing with your prayer and spirituality, whatever it is. I really do think it's helping you just peel away the layers to really find yourself and your true authentic value in who you are and really finding yourself. And all of these treatments, all these medicines are simply a tool.
Yeah.
So I've had to, I'm in my 40s now. So being able to I understand it a little bit differently than I did as a graduate student, having to just read through all the research and almost like you have this problem, use this treatment to fix it, and then move on with the rest of your life. And that's not really how it works.
Especially not for women with our cyclical nature.
Yeah.
Right? But what you're saying reminds me of a quote that I love. You have to learn the rules to break them.
Mm.
Right? So it's like I have this image of you going through grad school in your medical training of like, okay, let's check these boxes, right? Especially we want to be good students. We want to like get good grades. A lot of our education model is sort of regurgitating the information
Yes.
we receive, right? So it's like, okay, let me check these boxes, the boxes of what the professors want, the boxes of what the accrediting body wants, the boxes of
Mhm.
like me being a good student because I'm getting the A's that I need to feel like I'm doing a good job, right?
Right.
You got to learn those rules. And then it's like with enough experience, like you're saying now, 20 years later, you can look at those rules and be like, okay, I could see, because now you have the privilege of experience to know patterns, right?
Mhm.
So you can look back and be like, oh, this patterning, and there's so much knowledge and so much wisdom from the learned experience of actually being in the field and seeing it actually play out.
Yes, absolutely.
Yeah,
Mhm.
how cool. And so when did yoga come into your life?
Well, so coming from the medical model training as a clinical psychologist and learning, you do assessment to figure out what the problem is, and then you apply a treatment plan. You decide which evidence-based treatment you're going to use to treat that problem. And so I had a lot of training in CBT or cognitive behavioral therapy, which is an amazing modality. There's a lot of different variations on CBT. And so that's what I was trained in, the different practicum sites that I had throughout my doctoral program and then in the internship. So I came into the Air Force for my doctoral internship and postdoc,
Mm.
and the Air Force was real big on CBT. And then I ended up separating from the Air Force and started my private practice, continued doing a lot of CBT in treatment. And so that was probably 10, 12 years into my career. I was like, you know what? CBT is great, but there's something missing.
Mm.
Not everything is cognitive, not everything is frontal lobe.
Mm.
And so some people would get better, some people would get significantly better, some people got a little bit better, some people no change really. And so, and that was right around the time that I started practicing more mindfulness techniques myself, and I got really into yoga myself. And so I thought, you know what? I need to figure out a way to bring yoga into my clinical practice. So I was actually just looking for a regular yoga teacher training and was like, I guess I'll do the teacher training and then I'll figure out how I can incorporate it in treatment. But then I ended up finding a clinical yoga teacher training program. So that was designed for mental health providers.
Whoa.
And that was amazing. And so I was able to, because I'd become really involved with yoga and finding a lot of peace and comfort on my mat with my meditation, with the different pranayamas, the breath works that I was learning in yoga. And then being able to add it into my practice was really cool because I was able to be in a typical treatment session with a patient with talk therapy and be able to incorporate either these yogic principles or the yogic wisdom, the Eastern philosophy wisdom that is very much directly related to mental health, and be able to teach people different types of breath work in sessions, and able to even always had a big office, so I have yoga mats in my office. We'd even get on the floor and do some yoga in individual sessions. And then I started a women's trauma yoga, kind of clinical
Wow.
yoga program at my clinic. And now we have that has still been going for like 6 years. And we also do kind of drop in clinical yoga classes as well with different themes. So that's added a whole different dynamic into the way that I provide treatment is, because the cognitive piece isn't going to work for everybody. You oftentimes have to bring the somatic in, because people can tell themselves something all day long and they can believe it intellectually. But if your body's not on board, if you can't feel safety in your body, if you can't feel it head, heart, and gut, then it's not going to work. And so I've really loved bringing the clinical yoga in because it helps people so much. My goal in the practice with clinical yoga, and I have a team of teachers now. I have a group practice now, so I've got other clinical yoga teachers. My main goal with clinical yoga is to help people feel safety within their own physical body. So feeling safe in your nervous system.
Yeah.
Because so many people, especially with trauma and anxiety, like you feel like your own body is against you and like trying to kill you. It feels incredibly safe to just live in a body with anxiety.
Right.
And so that's really the main goal, is for people to kind of befriend their nervous systems and learn how to sit oftentimes in that discomfort, you know?
Yeah, the window of tolerance, right? How to I was just talking about this with a client today, shortening the window of tolerance of self-inflicted pain from not
Yeah.
living in alignment with those brains, right? And how to then also expand the window of tolerance for pleasurable experience, for peace, for joy, for
Mhm.
happiness, right? Because when
Yeah.
we're living with trauma, it's that level of misery becomes our comfort zone, right? And so then
Mhm.
and then the brain, God bless us, right? It's like a merry-go-round. You can talk yourself in or out of anything all day long, like you were saying, but then to bring it down. And I talk about the four brains, the three that you mentioned, the head, heart, gut. And I also talk
Uh-huh.
about the sex organs, right? Because those are also in alignment. If those are not in alignment, or if they're not a part of the conversation, then you just
Mhm.
have a full-blown war with
Yeah.
yourself,
You got to
right?
get
Like,
all the parts on board. Yeah.
yeah, exactly. And I love you mentioned IFS in your bio as well, and doing that parts work, right? Of just like
Mhm.
how to get all those parts on board, right? Like head, I know you think it's really important to keep working until,
Right.
burn that midnight oil, but like, heart and gut and sex are just like they need a break, they need a little attention,
Mhm.
they need to maybe like move, dance, like
Yeah.
express whatever it is. So
Mhm.
I just love learning. I got the experience of going into talk therapy when I was really young. And it never really helped me. And so I went on this alternative path for the past, I don't know, 25 years, whatever it is now. And I love coming back to this field and being like, whoa, all of the therapists like are doing the things that I have actually found healing in. And it's so
Yeah.
uplifting and exciting to hear all of these
Uh-huh.
things coming in, like the IFS, the yoga, the talk about
Yeah.
trauma, like actually get out of the
Mhm.
brain. I'm so impressed by the psychotherapy field right now in a way that I have never been.
I have that same experience, even though I've been in the psychotherapy field now for 23 years or something. and I don't know if it's just who I was surrounded by the first, 12 years, but since I've been independent and owning my own business and being able to do my own thing, I've branched off more into the somatic modalities,
Mhm.
IFS, psychedelic medicine, psychedelic assisted psychotherapy, yoga, meditation, mindfulness, that kind of stuff. And so it doesn't mean it wasn't there in the 80s and 90s and early 2000s. It's just I wasn't exposed to it in my clinical training or in the Air Force.
Oh god.
And so I had that same experience too, even, like where I'm so I don't know if it's a real change in I mean, definitely the psychedelic assisted psychotherapy
Sure.
is, become a lot more mainstream the last few years with all the research that's been done to prove what, people have already known for millennia
Of
with
course.
the healing energy from these plant medicines and everything. But yeah, that's cool that you're finding that now in the mental health field where you had to find that on your own when
Yeah,
the rest
and
of the field was
it's
not giving
also
that to you.
yeah, I have the same question all the time too of like I'm like, "Oh my gosh, the world is catching up to somatics and, subconscious work and psychedelic healing." And then I'm like, "Or is it just the world that I'm now marinating
Yeah,
in?"
I know that.
Uh,
I think the same thing. Yep.
so we won't know the answer to that. But it's conversations like this that make people see what's possible. And what I'm finding with the population that I work with is, especially since COVID, they are more open, like, to the things that work, right? And so people are, I'll ask clients because I think I love to bring consent into everything that I do, right? Like, are you open to trying something weird? Like, let's try like shaking it out. Let's, try these
Mhm.
things. And every single piece of feedback I get is when it works, they don't care.
Yeah.
They don't care how weird it is. They don't care because they're trying the normal stuff. They're trying the
Right.
talk therapy. They're trying the spinning the wheels, the, emphasis on the frontal lobe, all of that. It's not doing it. And it's like, people are just like, they don't care anymore. I don't care why getting up out of my desk and shaking for 2 minutes in the middle of
Yeah.
my workday works. It works. It helps me refocus. I run a virtual group hypnosis, right? And people just
Mhm.
show up and are just like, I just need to like reset in the middle of my day, and they're like, I don't care what we do. It's just like, I know I'll feel better.
Yes. Uh-huh.
Yeah. So people are just like, I think the mental health field, right? Like if we're talking about the 80s, the 90s, even the early 2000s, that was where the crazy broken people went to get fixed. And the conversation now is we all need help. We all need to just have someone to be a soundboard because otherwise, really, it's just you and your own thoughts for your whole life. Like, is that a good idea?
Yeah. Yeah, it's really such an interesting shift to see what's happened with groupthink around psychedelics
Hmm.
because, I was born in 1982, so I was an 80s child with Nancy Reagan's Hugs Not Drugs and Dare and Just Say No, all of those things and then in high school I grew up in the suburbs of Chicago, so hearing about people doing Molly and I don't know if we or ecstasy is what they
Right.
called it back then. Now people call it Molly, whatever, basically MDMA or LSD or mushrooms. I didn't really hear about people doing ketamine at my school, or I didn't at all. Um, but it's has such a negative stigma. Illicit drugs have such
Totally.
a negative stigma. And then, and I live now in Utah. I've been here for 15 years where there's a dominant religion here
Right.
has a really important belief in not using substances. So
Right.
like alcohol or drugs. And so coming from, being an 80s child and being in that generation and hearing such bad things about drugs, even like all through my schooling, all drugs are bad, And then even though there's always been research in the Western world that has proved that psychedelics are healing for a number of different conditions. But some of that information I think was suppressed, at least in
Oh,
like the
yeah.
academic community. Um, but so now, of course, like clinicians are learning about it and implementing it. And then people are finding it just on their own healing journey. And so it's interesting now, kind of being here in Utah with people that have a really strong belief in not using drugs or alcohol. that like they would never in a million years think that they would ever do ketamine, but they're so sick and tired of being sick and tired, and they're so sick of like having their antidepressants for 30 years and it's not working, and doing a lot of hard work in talk therapy, but just being stuck, that people are like, okay, I'm willing to do this. I'm willing to try this. It's a prescription medicine. It's been proven to be safe. A lot of the outcomes are even more promising than traditional psychotropic medications and things like that. So people are willing to try, just like you're saying, people are willing to try things that will work, and so informed consent is a huge piece of that. You want to be able to educate people on the risks and benefits and alternatives, but people want to help themselves in a way that's going to be helpful and not just do the same thing over and over again and get the same result.
Absolutely. I think I'm just reminded of Dr. Carhart Harris, his book, Drug Use for Grownups.
Oh,
It's such a great book. And he talks about, he talks about a lot of things in that book. We can go in 100 directions with that. But this idea of, like this Puritan base of the foundation of this country, and
mhm,
how it's, you could do that, right? You could white knuckle and shit all over yourself. And like you were saying earlier, believe there's something wrong with you, whether something works for you or not. If the
yes.
underlying belief is something's wrong with me, then it's going to color the therapeutic benefits of whatever you do, whether it's talk therapy, CBT, DBT, psychedelics, whatever. And
Mhm,
so it's getting out of that narrative of should and shame and all of that to, hey, I'm someone who's accumulated experiences that I need help dropping,
mhm,
and what's going to help me with that? Great. Let's go there.
mhm.
Yeah. So with the ketamine, when did you add that to your practice, and what was your impetus for it?
I A friend had told me, I'm trying to I think it was like 2021, I think, is when I started really reading clinical books about psychedelic medicines and going to conferences, because I was just really interested to know what the research was saying, because I was interested just as a human being, and who cares about what the research says, but as a clinician, it matters what the research says. And then ketamine, of course, is a medicine that has been FDA approved since like 1970 as a dissociative anesthetic. And so that's what I was really looking into more, for an actual treatment that could be provided, that I could provide in my clinic. And there was a ketamine infusion clinic that was co-located in an office space that I was renting. So I would talk to the ketamine provider a lot about, because he was a CRNA, he's a CRNA, so he's not a mental health provider, but now he started this mental health business providing ketamine. I have a doctorate in psychology, so I know a lot about mental health, but I don't know anything about ketamine. So I learned a lot through him, and then just going to conferences, just in general about psychedelic medicines, and starting to learn more and more about ketamine. So I I added ketamine-assisted psychotherapy to my practice 3 years ago. So it was 2022 in January. Um, so just over 3 years. And then actually the CRNA who had the ketamine clinic, I ended up purchasing his business when he retired. So I acquired a ketamine infusion business. So now I have a medical business and a mental health talk therapy business. So my companies are able to provide ketamine treatment multiple ways. Ketamine
How
assisted
cool.
psychotherapy versus medication as a standalone treatment versus, the infusions one day and an integration session another day. So there's a lot of variety in what we can offer our patients. So
That's incredible. And just 3 years in, and I can only imagine. So what are you seeing now with all the different varieties of psychedelics that you're offering? Well, not the psychedelics, but the options for how to take ketamine. What are you noticing?
my I'm not a researcher. I don't really have any interest in analyzing the data that we have. So if anyone listening to this is a researcher or a grad student and wants to analyze the data for my clinic, please reach out. But what I've noticed anecdotally in terms of ketamine treatment, so the medication treatment versus cap, we are noticing that people are coming in for boosters more regularly when it's ketamine infusion as a standalone medication versus when they're doing the full cap protocol, which is like 2.5, 3 months. Usually it takes people to get through that whole protocol. People are requesting boosters far less often with cap.
Okay.
And in terms of what we're hearing from patients, people are getting more of the long-term benefit from cap because there's such a heavy emphasis on integration.
Mm-hmm.
The medicine is helpful, whether you're doing integration or talk therapy with it or not. But I think the longevity of and the really how much change people can make seems to the change is more robust with cap. And that's just what I've noticed anecdotally. And then there are more research articles being published, like meta-analyses I've seen where they look at cap versus ketamine treatment, like standalone medication, and they are all concluding that the treatments are more effective when you pair the psychotherapy with the medicine.
Yeah.
So that's what we're noticing. But there's some people that don't want to talk to anybody. So they would not be well served going through cap,
Right.
Or some people have such significant depression that they literally have nothing to say. So it's not the best utilization of their time, my time, their funds to do cap. It makes a lot more sense for them to do infusions
Right.
and let the medicine do its job.
Yeah,
But for some
absolutely.
people, they're not going to get as much out of it unless they're able to experience the medicine with a therapist there, being able to help them in the moment when they're under the influence of the medicine and doing the integration session. So it really depends on the needs of the patients and what's going to work best for them in their life right then.
Absolutely. And it's, the way that I think about it with the subconscious mind, right? We're talking about grooves, right? So depending on how often someone's been like, say it's a path. And if they're walking on that path back and forth, back and forth, back and forth, and they're like, knee deep, thigh deep in whatever way of operating. And, some people, like you said, like they need someone to help them get out of that path. And some
Yeah.
people are just so sick of that path that their first avenue out of it through just a standalone ketamine session will get out of there. But I completely agree. And that's that's the work that I've been doing since 2021 is helping people with preparation, because it's if people don't know to make different choices, then they might still have the ketamine and then go back to old ways of thinking, behaving,
Right.
and then they're digging that groove in deeper.
Mhm.
So I agree that it's really, as much as the ketamine as a standalone is amazing, when you pair it with proper preparation and proper integration, that's where you have, I think, the fullest potential realized.
And there was a research study published during kind of the FDA clinical trials when they were looking at the utilization of ketamine or S-ketamine for major depression. So this study was actually published in the book, The Ketamine Papers,
Mm-hmm.
which was a book that MAPS published. It's kind of like a compilation of the research on ketamine. But there was a really interesting study in that book about ketamine-assisted psychotherapy. And they had these people go through, like, I think it was a 60-day program before they even had any medicine, where they worked on their lifestyle behaviors. So
Right.
eating, like clean eating, getting outside in nature, grounding in nature, exercise, open communication instead of like stuffing everything down, expressing. And then, of course, all of the expectation management and preparation work that we do in anticipation of the ketamine work. Then they did the ketamine treatment, ketamine-assisted psychotherapy with group integration, individual integration, and their outcomes were substantially higher than kind of the standard like 60% effectiveness rate that they were seeing across the other studies when it was medication alone. So I think that's also a really important piece that we can add for people is not only pairing the medicine with psychotherapy and integration work and the preparation on the front end, but also helping people know what they can be doing in their day-to-day life to help the effect be even more robust, to get even more out of the medication. Because again, it's a tool, it's an opportunity for neuroplasticity, for greater neuroplasticity in the brain. So it can help people kind of get a leg up to be able to work on their eating, to be able to have a, stricter bedtime routine and morning routine to help their sleep and moving their body and get outside and everything. And so if you add all of those things together, it's just going to be so much more effective for people.
I mean, yeah, because you're all the things you're talking about are their own medicine, right? Like having a
Yes.
good bedtime and morning routine, having eating clean, right? Like 95% of our serotonin is produced in the gut. When you eat in a way that actually supports that, that's going to help everything else. And we're just a society that is looking for that thing, right? I'm here for it because I think one of the blessings of something like ketamine is that people are, when they go into such an experimental therapy, because most of the people doing ketamine are not the people that are doing ayahuasca and other psychedelics, right? These are people that are, yeah, just a different population that isn't as maybe adventurous, isn't as experimental, who is reading research, who wants the research and things like that, who are more evidence based, like I
Yeah.
am, like you are, right? And so when you take someone like that who's going through something like ketamine, there's something internally that says, I'm not coming out of this the way I went into it, right? This has to be the line in the sand from who I was to who I'm becoming. Like, really, like, I just taught a preparation course last week and we were talking about the liminal space. And we're talking
Mm-hmm.
about the archetype of the caterpillar. And it's like the caterpillar is just living its caterpillar life, find a stick to hang off of, like I don't know why, but I got, it's like that's what the call to psychedelics is. It's just like I don't know why, but something's got to change, right?
Yeah.
And when you combine that, like, higher calling, you can call it soul calling, higher self, God, whatever you want to call it, the name that has 1,000 names, right? You combine that with earth medicine, meaning like the 3D medicine of taking care of your earthly body that is the container
Uh-huh.
for all of this journey. And then you have this robust offering. Like I just finished up a 30-day, I think it's been 30 days. Yeah, 30-day cleanse.
Mm.
And I do it every year. And it's just like, yeah, like the level of like wellness that I feel right now is way better than I was when I was pounding chocolate on Valentine's Day.
Uh-huh.
Because all of that matters. And ketamine, like you said, is a tool. I like to poke the bear a little bit and say, if ketamine alone changed your life, wouldn't everybody who did it at a rave be enlightened?
Yeah, seriously.
It's not
Yeah.
about the ketamine, it's a tool and how you use that tool.
Yeah. And really a tool and an opportunity, you know? Like I really think about it as an opportunity because people can use it and not take the opportunity to make change or think about things in a different way, you know?
Yeah, I talk about life in a similar way. I talk about everything being an invitation. So
Mm.
sometimes, and a lot of people coming to ketamine that I work with personally have a history of anxiety, anger issues, and just like a tension with being with reality, right? And so when you talk about like the ketamine helps you see it as an invitation, right? Like, oh, someone just caught me off in traffic. Here's an invitation to freak out, or it's an invitation to do something else, but you don't see those other options
Yeah.
until you have some of that activated heightened neuroplasticity.
Yes. I love that invitation. I like that better than opportunity. Yeah.
Yeah.
Mhm.
I use it all the time. I'm like, oh, here's an invitation to freak out. Here's an invitation to lose my shit. Here's an invitation to like get really angry at someone who has nothing to do with what I'm actually upset about?
Mhm. Yeah.
So yeah, I love that so
Mm.
much. And so 3 years into ketamine, anecdotally, yeah, I'm also going to shout it out. If there's a researcher that wants to geek out on the data, like let's get in there because
Yeah.
as much data as we're having, like let's get more there because we really are, when we talk about spirituality, we're in this age where science is our spirituality, right? We believe in what we can measure and what we can kind of quantify.
Mhm. Yeah.
Yeah. What are you noticing with ketamine and spirituality? I'm curious.
Well, the way that I conduct ketamine-assisted psychotherapy at my clinic and the way that I train in the training course that I have, we do our CAP medicine sessions over 3 hours, and we
Mm.
begin the session with a grounding exercise. So, some kind of meditation, breath, smell, sound, movement. So, it's kind of yoga style on the floor with yoga mats to really help to settle the nervous system and ground the person in back into their intention of, what is their intention with the medicine. So it helps to really build that safe container for the session they're going to have that day. And then they take the medicine. So
Mm.
it's a very holistic approach. And, we have to be careful as licensed clinicians to not try to push anyone into spirituality or religion or anything like that. But really, I mean, we could even use terminology from CBT. We can use terminology from IFS. We can use terminology from kind of Western mindfulness. And it's kind of all the same thing. It's helping people become grounded into themselves and into their knowing and centering themselves on what their intention or their goal is. And so, and people love it. People love doing CAP with us because it's more of a holistic approach. And people that are spiritual can bring their spirituality into that kind of ceremony, that opening ceremony that we have for grounding.
Mm-hmm.
And they find that very helpful. And we'll do, guided visualizations or meditation to, it really can be individualized to the patient when we're doing an individual medicine session. We also do group medicine sessions. So
Nice.
then we lead that grounding exercise for everyone in the group. So it's not always tailored exactly to what an individual person needs. We do it for the group. But I really like that because it blends kind of the clinical and medicine piece with holistic practices, but in a safe clinical space, but it
Right.
doesn't, it's very different than our infusion treatment rooms. That feels very medical, but CAP medicine sessions are much more holistic. And so it's just a totally different vibe for people
Right.
and what type of treatment they're choosing.
Which is what they need, right? And so it's, I love this because some people, not everyone has good experiences with the Western medical system. So if they walk into a room that reminds them of that could, be activating in a way that's not conducive to their healing. And for other people, they have amazing experiences with the Western medical model and they find a lot of peace and comfort in that. So that for that
Yeah.
person, it's like, great, I'm in a familiar environment. And so, but with what you're saying, my personal preference are the settings that
Uh-huh.
are a deviation from the norm, right?
Mhm.
Because then you start getting into what is it, Joseph Campbell's hero's journey, right? It's like that break from the known, from the ordinary world into the extraordinary world, right? You walk into a clinician's office and they go, great, take off your shoes, we're going to get on a yoga mat. The
Uh-huh.
subconscious mind is already like, this is not ordinary,
Yeah.
right? Like you're already priming the subconscious mind for change in other ways, like with the
Mhm.
lighting, with like the
Yeah.
questions you ask, like, okay, we're going to do some grounding exercises. Most people are not doing grounding exercises at home. And so that's
Mhm.
already getting their subconscious mind primed for like, hey, this is going to be something different. And
Yeah.
that's what people want because they've been doing the same thing over and over. It's not working. That's why they're here with ketamine.
Yes. And there can be the people, with their individual differences that would not be able to really fully open up to the medicine in a more holistic setting. So they would feel much more safe, like you're saying, with the nurse practitioner sitting there checking them and their vitals are being monitored the whole time. Like they're able to feel a lot safer. Maybe they
Totally.
have a medical problem and they're just like terrified something bad's going to happen in the ketamine. But as long as the nurse practitioner is right there with me, they'll protect me. They got my back. So that person might be able to go much deeper in that medical setting versus in a holistic setting. So like everybody's just so different. But I think that's a good point that you mentioned. It's already priming the subconscious of like, this is something different that's happening. So it's more of an invitation to have a different experience, think in a different way, feel in a different way.
All about subconscious priming. We could have a whole conversation about that. I could like review your practices and be like, here are all the, because I'm hearing it, you're already doing it.
Yeah. Uh-huh.
You're totally already doing amazing work and priming people for big change work with everything that you're bringing in. So, yeah, I'm happy to connect and tell you more about the amazing work you're doing. Which, speaking of, you have a course that you teach that is about teaching people how to set up their own CAP practice. Is that right?
Yeah. So the first half of the course is clinical didactics. So we do a lot of kind of background information just about plant medicines from ancient times to, in like the 1900s with the discovery of LSD and MDMA and ketamine and all these other medicines. And then kind of the research that got shut down in the 50s and 60s in the US. And then the research on ketamine since 1970 and how it helps with mental health conditions. And also the differences between ketamine and S-ketamine and just explaining the FDA indication so people can understand that. And then really going into how I lead ketamine-assisted psychotherapy. So that's a pretty heavy didactic on really like everything I want people doing in the intake assessment and everything I want people to go over with expectation management and preparation and informed consent is huge, 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 huge. And then being able to provide as much psychoeducation, kind of meet the person where they're at, and kind of how to help people set intentions, and then how we do the 6 medicine sessions and 6 integration sessions, how we do termination. And I also train on a lot of different examples of those grounding exercises that I like to do.
Wow.
And I give a lot of case examples, and my CAP director helped me record some of the content. She's given case examples in the training. And we also, I've done training with another practice here in Utah that started one of the first ketamine clinics. And they are located near a medical school. So they created a breathwork protocol and had the medical students come in and publish a paper looking at how this breathwork protocol increases the bioavailability of the ketamine troches.
What?
So because in CAP, we're using oral ketamine that dissolves. And so bioavailability is much lower than IV, IM.
Right.
And so they were able to find that the ketamine troche dosages are more effective and give a bigger experience for people when you pair it with the breath work. So we also do that. So as they place the ketamine to dissolve, and it can take 5 to 20 minutes for it to dissolve in their mouth, then they're doing this breathwork protocol. And so like I teach all about that 3-hour medicine session and why I've structured it the way that I have.
Yeah.
And then the second half of the course is how do you add this into your practice from an ethical, legal, logistical way, there's one thing that took us the very longest to figure out was video surveillance. Researching, I talked to multiple psychology consultants, lawyers, learning like the Medicare laws and like data storage for HIPAA compliance and everything like that to make sure that we were setting up our video recording system in a HIPAA compliant manner that was going to end with figuring out the data storage and everything. It was just, and we have 4 locations. So it was just kind of like, and we have all these different ketamine treatment rooms. So it was just kind of a huge, long project that we had to figure out. So then it's like in my course, I just like can say, hey, there you go.
Right.
That's how you do it. And they don't have to like spend a year to figure it out, And so that's really what the course is packaged. It's like all the money I've spent over the last 4 or 5 years researching this stuff, all of the consultation fees I have paid other people to learn stuff and be able to staff cases with, and all of the time I've put into it. And then it's just kind of packaged for people of like, hey, this is how I recommend you do it. Because there's really no one protocol for CAP.
Right.
Like EMDR, there's a very standard protocol from EMDR, and then different training companies can teach EMDR. But CAP is so new. Luckily MAPS has provided like an MDMA-assisted psychotherapy protocol. So that's amazing. And now there's a lot of research on that. But in terms, the S-ketamine got the FDA indication, and then people are now, ketamine clinics have popped up all over the place in Utah, especially. There's certain states where there's not as much ketamine treatment going on, but really the only thing that's sort of standardized is that it's recommended to have 6 to 8 medicine sessions. That's like,
Right.
we really know for sure. But
Right.
so I've kind of created this protocol, and it would be super cool if more and more providers implement CAP just like I am, because then we can collect massive amounts of data to really see the effectiveness of it and be able to research how many boosters are people getting, how far are they spread out when they come in for their boosters, what are their kind of mental health questionnaire scores looking like, things like that. Why are people reporting they're coming back in for boosters? All of that would be super interesting. So yeah, that's my training course. And then I have trained 5 clinicians that work for me in this CAP model. So it's what we're using in my practice.
So cool. I mean, I can only imagine how much wealth of knowledge is in this course. And that's something that I love. My mentor says is, you can spend the time or you can spend the money. Right. And it's just like, which way do you want to go? And a lot of times it's like you spend the money, you fast track the learning, and then you're up and running much faster. And as we know, right, it's not knowledge that creates power. It's actually action, right? So you have something like your course, and then you can actually take action to set up a practice.
Yeah, because I've talked to a number of mental health providers in Utah that went through either the MAPS training course or one of the others. There's a few kind of popular ones that people will go through. And I had 2 ladies that had been through a 10-month training program that cost $10,000. And they said, like, I feel really confident on how to do the treatment, but like, I have no idea how do I do it? Like, how do I start it? Like, what do I need to think about? And so there's more to just learning a protocol. You have to figure out, can you add it into your like institution or clinic? Like I own an outpatient group practice. So as long as I'm, like following all the protocols with like the liability insurances and the premise insurance and the laws, federal and state laws, and my APA ethics code and everything like that. But I don't have the limitations of working at like with a hospital system or an agency that has their own rules. So that's nice about because I haven't found a psychedelic assisted psychotherapy training course that talks about any of like the business side of actually how to implement it.
Yeah, and that's important, right? Because you have to make sure that you have all the compliances, that you're doing things, because people's licensure is at stake.
Yeah, and people's safety's at stake. So like this is why I've added the video surveillance, because there are people all over the world in every profession, in every setting, that abuse other people. It's just the reality, and it sucks. So, and people in an altered state of consciousness, so a non-ordinary state of consciousness, are incredibly vulnerable. And so I feel like we have a higher level of obligation and ethical duty to protect these people. And we want to be protected too. Like the clinicians want to be protected too when people are in an altered state of consciousness. So it protects all of us to have this video surveillance system in place, And so, because the number one most important thing is patient safety and making sure we don't harm patients. And so that's so important to make sure that you have adequate, substantial training to even be able to start implementing this.
Yeah. And for certain populations of clients and patients, it's for them, depending on their background, their trauma, it is actually really comforting to know that there is video surveillance that they can reference, and that can provide a higher level of safety for someone with specific type of trauma. I can think of a few clients that I work with that would really appreciate that.
Yes, absolutely.
So amazing. We will have all of that linked in the show notes for sure, so people know where to find your course, and get this wealth of information that you've put in. Thank you for doing that. Right, like you're running 4 practices. You're doing so much, and then you're just like your generosity and wanting to give back to this field and give and really like pay it forward, because the more people we have walking this journey together, right? Like we heal in community. So let's get this out there in
Yes.
a meaningful way.
Yes. And I think it really helps. I mean, we see this in with so many professionals, whatever your craft is or your trade, where people that are really passionate about what they do, like it shines through. And I've even talked with my CAP director about this. You know, the people in our business that have been personally touched by ketamine or psychedelics, either for that it's helped them or a family member or loved one. Like it really just the way you talk about it and explain it, you can just feel the passion from people. And that comes from like a personal knowing that this can be such a helpful tool, you know, so
Amen.
helpful as an opportunity and invitation for people.
Amen to that. Absolutely. Well, thank you for your time today. Is there anything else you want to throw in before we wrap up today's episode?
One thing I didn't talk about at all is integration. I want to at least say something about integration, and maybe we'll want to talk about it for a few minutes or maybe not, if that's okay. So, one thing that I found in all those conferences I went to, and all the books that I read, and all the documentaries I watched, and all the patients I talked to, and all the other psychedelic medicine providers that I talked to, is like, what the heck is integration? Like, what is this? Everybody in psychedelic medicines talks about like how you have to have the integration. So, 4-ish years ago, 5 years ago, when I'm starting to learn about this, it's like I couldn't find really a definition in the literature of like what is integration, or it's not like in the conferences. I mean, sometimes they would even have a full hour or like a full 2 or 3 hour breakout on integration, and it still did not answer my question, what the heck is integration? So I feel like it's very elusive, like people don't
Yeah.
even know what it is half the time.
Yeah.
So I've had to figure out for myself, what do I think is integration?
Yeah.
And I really had to use my own personal experiences on my healing journey and everything that I've experienced in like religion, spirituality, or learned from other people with their religion and spirituality. And then on my journey with ketamine and psychedelics over the last 4 years, to be able to figure out, what do I think integration is and how am I going to help guide people through integration? And really, it's actually integration is something I've already been doing with patients my whole career. They do it at church. Basically, integration is remembering to remember. And so that's another big piece of my course that I talk about and give a lot of
Mm.
examples of how you can help people do integration. Because really, what I find, and I've seen this throughout my career, I've personally experienced this. I've seen lots of patients experience this where, so like think in like a regular talk therapy session, someone might have a really big aha moment. So like as the psychologist, I'm like, oh my gosh, this is so cool. This is going to change everything for them. Like so amazing that they figured this out. And then like a few sessions later or a few months later, I'll like ask them about it and they'll be like, I don't know what you're talking about. Like they totally forgot. And it's like, oh my gosh, how could you forget that? That's like huge. Or, people have these spiritual experiences and be like, oh my gosh, I'm never going to forget this. I don't even have to write it in my journal because I'll never forget this. And then time goes by and we are human beings. We're literally going to forget
Yeah.
without repetition and without applying it to our lives. So this integration is remembering to remember
Mm.
and figuring out how can we call in those feelings and sensations, thoughts, images, or whatever that we had in ceremony with a medicine or with an experience, and be able to have that feeling kind of resonate now in the middle of a panic attack, or now when you're in a work meeting and you're super pissed at your coworker, or now you're on the freeway and you just got cut off and you have road rage. Like, how can you call all of that in to the present moment? And that's one of the big reasons why I use that holistic approach, because people are going to learn better with paired association, cued association. So it's basic behaviorism. It's like operant conditioning. So if someone has an amazing, beautiful ketamine experience, and they always have lavender essential oil, and they always have the same music playing, and they always have the same intention mantra that they're repeating and the therapist is repeating, and they always have the candle burning and they're seeing the flame, and they always have their fuzzy blanket with them. So they're having all these sensory experiences that are cued with this amazing, super unique psychedelic experience, because we can't be on psychedelics all day, every day. Not possible. But we need to we can benefit from calling that experience back in to our everyday lives. And we can do it through this operant condition, you could call it cue. So, there's a lot of words in psychology that we can call it. Even muscle memory, that's a term that a lot of people know, are familiar with. Like, the more you practice a task, then it turns from your frontal lobe having to think about it to procedural memory, which is a different part of your brain.
Right.
So things just become easier. So that's exactly what we're talking about with integration, is how can we help the person create really strong associations with their healing experiences that they can then recall and bring up in their day-to-day lives so that they can remember to remember.
That is the best definition of integration that I've ever heard. I'm obsessed, remembering to remember, right? Because you're absolutely right. It's we're so focused on the ceremony, we're so focused on the epiphany, on the aha moment, on the breakthrough. But how many people go to a Tony Robbins event, have a breakthrough, and then go back to their regular lives and don't do anything with that breakthrough? The process of integrating that, right? It's like these big experiences go beyond what is it called? They go beyond psychedelics. I just had a friend who just went through a week in Austin. We had a South by Southwest, right? And she's talking about this experience coming out of this conference. And I was like, oh, do you want help integrating a big life-changing experience? Yeah. I'm really good at that, because that's what we're talking about, is anything that changes our perception of what's possible for our lives. And you could look at it like a piece of art at a museum and walk away and get on with your life. Or what you're talking about in hypnotherapy, we call it anchoring, right? How do you anchor that experience? Another thing that you're doing brilliant and right, by the way, is using sensory cues. So that is a holistic, right? When we talk about holistic, we're talking about a whole experience. So it's not just, oh, I'm in a psychedelic trip in my mind, but how do I bring it into my body with sensory input like smell, touch, texture, etc., that makes it easier to remember that. And then what you're saying of integration is remembering to remember, right? Like, oh yeah, that's right. I'm not going to get mad at that person in traffic anymore, right? Like, oh, I almost did it, oh, no, I'm going to make a different choice. And then you just you can physically feel, depending on how long you've lived in this way of being, you can physically feel the discomfort of change, right? Of redoing that of redoing the muscle memory, right? Of taking something from conscious to conscious competence to unconscious competence, right? To remember to practice being a different way. And this topic speaks so near and dear to my heart, because in 2018, I went on a psychedelic journey that changed everything. And for 2 years, I was already working in hypnotherapy, and I was like, what happened to me that weekend? What did the psychedelics do to me? They didn't do anything. I integrated. I went through this deeply uncomfortable period of making a different choice than I used to every day, because in my body, because I had the privilege of having, however many decades of yoga at that point, in my body, I knew that I had to make a different choice, but most people don't know that. And so the more we can teach tools for integration, I completely agree with you. People go, what is integration? You can go through a whole 10-week course and come out of it just as confused as you went in.
Or a 10-month course, yeah.
Sure, yeah. Well, I actually did that once. I went through a 10-month course on psychedelic integration. I was just like,
what?
Huh? Yeah.
But everybody's so different. Everybody needs different types of integration.
Absolutely.
And so that's what's so cool about working with people one-on-one, because you can learn about them. And I had one patient who loves going to the gym. She feels very grounded. She feels amazing in her body. And she always does stretching at the end for 20 minutes. So what we did is we recorded a guided meditation that was 5 minutes long. So she would go do her stretching and listen to her music for 15 minutes. And then she would put on this integration recording for 5 minutes where we had the sounds and we had the intentions coming. So she would listen to and she went to the gym 5 days a week. So that's how she did her integration. And it was amazing, because she paired it with something that she was already doing every single day. So it didn't take any extra time.
Habit formation, right?
But
Habit formation 101. You tack it onto something that you're already doing.
Yeah. So everybody's so different with the type of integration practices that they can implement.
Absolutely. We'll have to talk, because what I'm doing right now is I'm creating subliminal recordings for people to take into their ketamine journey, so that their intention, so whatever this client has in her, right? Because sometimes we need to hear the language, and sometimes we don't. And we know that the conscious and subconscious mind have different processing speeds. And so the conscious mind is just listening to just meditation music, and then the subconscious mind is hearing what your intention is for your psychedelic ceremony, whatever changes you want to make. And I have to say, and I'm working with them for myself as well, and whatever I'm working on, because the work is never done. And if someone tells you it is, then they're a liar. I like to remember that as long as there's breath, there's work to be done, right? It's just a matter of doing it, right? Yeah. And taking breaks, because it's never done. So you might as well enjoy the ride. But the stuff that I'm working on in my my own practice and bringing the subliminals to it has been so cool.
I want to learn more about that. That sounds awesome.
Yeah, thank you. And thank you for talking about integration, because you're absolutely right. That was one of the topics that we wanted to hit. I feel like we need to have you back on the show to talk more, because you're right. We could talk about any one of these topics for 3 to 5 hours.
Yes, this has been so fun to go back and forth with you. This has been really interesting.
And for me as well. Thank you so much. And we'll have all of your links in the show notes for the episode, so people know where to find you, where to find your beautiful course that can help super speed someone's access to becoming a ketamine practitioner. And just thank you so much for what you're doing for the field and being on the show to share your magic.
Yes, and thank you so much for everything you're doing. And I'm very interested to learn more about all of your work. It's amazing.
Amazing. We'll definitely connect.
Thank you.
Thank you.